but I am Dr. Rita McGuire, and hopefully you can see my first slide. I'm actually an obstetrician gynecologist of 30 years. I did my medical school training at Wayne State School of Medicine in Detroit, Michigan. Completed my residency right here in Chicago at Cook County. Now it's called the New Stroger Hospital. I'm CEO of RJM Wellness and Ripped Rita Fitness. I'm a global speaker for women's health and fitness. And I'm also a certifying physician for a medical marijuana program. I'm also one of the members for Doctors for Cannabis Regulation and the chief medical officer and one of the co-founders of Wakana for Life. So I want to welcome you to our Doctors Edition. You will meet my colleague, Dr. Joy Smith, who also feels very passionate about speaking to healthcare professionals about cannabis and really helping to inform, empower, and to end the negative stigma about this plant. So let's talk about the plant. Let's talk about the difference between hemp and marijuana. So cannabis is the family, and within the family are two species. One species you many have heard of, and that's the marijuana species. That is a species of the plant that gets you or gives patients a high. It has a very high level of THC or delta-9 tetrahydrocannabinol. That is the part of the plant that gives you the euphoria, the paranoia, even the munchies some of our patients talk about, right? It has a very high content, 15 to 20% or more of THC, and then very low levels of the other cannabinoids or compounds that the plant makes, like CBD. Whereas the hemp species is the part of the plant that does not get you high. It doesn't give the patient the euphoria or the paranoia or the munchies. But what it does do, it does very well at doing in giving the medicinal benefits to the body that our patients are looking for. It can be from reducing anxiety in our patients to helping them sleep, to reducing pain. This is what the hemp species does. And the way it does that is that it has higher levels of CBD or cannabidiol, one of the main components of the hemp plant that gives medicinal properties. In fact, CBD is very good in reducing inflammation. It's analgesic. It helps with anxiety and sleep, and we'll talk about how it does that. And very low levels of THC or tetrahydrocannabidiol. And that's why hemp does not get you high. That's why hemp products won't give your patients the possibility of failing a drug screen or a urine drug screen like marijuana does. So that's the difference. So how did cannabis become so mainstream after being silent for many years? Well, Dr. Sanjay Gupta is really the reason why cannabis was brought back out to the forefront. Because see, in 2009, Dr. Gupta voted no to cannabis. And he was a staunch, very vocal physician in really not finding any medicinal benefits in cannabis. But it wasn't until 2013 when he came out and gave a public announcement and apology. And what he said was that he didn't dig deep enough. He didn't dig far enough in the research, nor did he look at other research and studies that were being done in other countries. And what really was a pivotal moment for Dr. Sanjay Gupta was when he met a little girl by the name of Charlotte Fiji. This is a little girl that has something called Dravet syndrome, we've all learned about in medical school. But it's a syndrome where children have between 300 to 500 seizures a week. And this was a little girl whose parents exhausted every traditional way of assisting their daughter in reducing the number of seizures. They tried hundreds of medications. They tried many, many different types of procedures. And they were right at a point where they were going to do a pretty invasive procedure on her brain. And then someone introduced them to cannabis. And within a week of using cannabis on their daughter, this little girl, Charlotte Fiji, went from having 300 seizures a week to having 2 to 3 seizures a month. Along with Charlotte Fiji's story were hundreds of other patients that Dr. Sanjay Gupta interviewed and met throughout his travels throughout the world. And this is why Dr. Sanjay Gupta said that we have been systematically misled about this plant. We haven't given this plant its due diligence in really offering an option to our patients for medicinal benefits for not only seizures, but other autoimmune conditions, conditions of chronic illnesses like diabetes, hypertension, and heart disease, mental illness conditions like depression, anxiety, just so many, many, many medicinal properties that the cannabis plant gives us. So when we look back in history, in 1930 is really when the xenophobic and very negative propaganda began on marijuana, despite marijuana or cannabis being used medicinally for over 60 years. It was part of our pharmacy, right? It was part of our medicine cabinets. In fact, there were over 100 medical conditions that major pharmaceutical companies that we all know and use when we write prescriptions for our patients today, like Pfizer, Park Davis, Eli Lilly, all of these pharmaceutical companies were using cannabis-based medication 60 years prior to prohibition in 1930. So in 1944, it's very interesting that the mayor, LaGuardia of New York, wanted to do a study on marijuana. He wanted to see really what the effects of marijuana was. And what they found in this study, and he didn't know that there were hundreds of studies that were already done in the 1850s all the way up to 1930, was that this compound, marijuana, was not a compound or medication that could be used that was bad. In fact, the studies that you can look up all the studies that they did, a lot of them weren't complete, showed that this part of the plant did not cause dependency like they thought that it would. It didn't cause issues with withdrawal symptoms like we see like in heroin and alcohol abusers. And despite the thousands of years that we've researched this, we've not ever documented one death from cannabis, not one. So that is a really interesting report that you can read. And when we look at our pharmacy, when we look at the medications that we use for pain for our patients, post-op pain, when we look at medications that we use for anxiety and depression, we look at the amount of people that die. Every 19 minutes, someone overdoses on medications that we as physicians prescribe. Every 19 minutes this happens. Now, sometimes this is accidental. Many times it's accidental. We see in our seniors, they just want to get out of pain. And they don't know. They don't realize that they've taken 1, 2, 3, 4, 5 Percocets or Norco or Vicodins. And so this is a real problem that absolutely this plant can solve, which is the opioid epidemic. So as physicians, you should know that you can use PubMed.gov. You can do so many different searches on medical marijuana, on cannabis, on CBD, which we're going to talk about tonight. In fact, there's over 20,000 peer-reviewed articles that you can find to really increase your knowledge base. So what you should know is that the FDA has approved a prescription called Epidiolex. It is a synthetic CBD product that we use to treat Lennox-Gastaut syndrome, Dravet syndrome, like the little girl Charlotte Figi had, and tuberous sclerosis complex. So this is the only FDA-approved CBD product. And again, it is a synthetic product, Epidiolex. So let's look again at the hemp plant. Now, the hemp plant produces high levels of CBD. Again, CBD is cannabidiol. It is the part of the compound or the compound of the plant, which can come from hemp. CBD can come from hemp, and it can come from marijuana. But it's the part of the cannabis plant that does not give you the high. And CBD has many, many medicinal benefits. CBD has been shown to be antibacterial, have antibacterial properties. It inhibits cancer cell growth. It's neuroprotective. It promotes bone growth. It reduces seizures and convulsions we talked about. It reduces blood sugar levels in your diabetics. It helps to reduce the function of the immune system. We all have patients who have hyperimmune systems, be it lupus or fibromyalgia, all of the autoimmune conditions. It reduces inflammation. It helps to reduce the risk of arterial blockage in our coronary artery disease patients. It reduces small intestinal contractions, as well as reducing nausea and vomiting in those patients that we have that may be receiving cancer treatment. It relieves pain. It relieves anxiety. In fact, the top 2 reasons that patients are drawn to using CBD is to relieve pain, to relieve anxiety, and to get sleep. Those are the top 3 reasons why our patients are looking to use CBD or are even using CBD. It also helps to slow bacterial growth. It suppresses muscle spasms. Lots of studies coming out of UC San Diego are looking at patients with multiple sclerosis and the use of CBD, as well as it's tranquilizing, it's relaxing. It helps to treat skin disorders like psoriasis and eczema and acne. And CBD is also vasorelaxant. That's why CBD has been shown to really be effective in reducing blood pressure. Why? Because we know our hypertensive and our heart disease patients have a lot of inflammation within the blood vessels. That inflammation, along with vasoconstriction, causes elevation in blood pressure. So CBD not only reduces inflammation, but also is a vasorelaxant. Now, what you'll also see in this slide are other cannabinoids or compounds that the plant makes. That synergy of CBD along with the other cannabinoids on a cellular level gives a very profound effect on the body. So when we see full spectrum products that are out on the marketplace, combining CBD with CBG and CBC and Delta-9 THC, we see more of an effective outcome and result in resolving challenges in our patients. So how does cannabis work in the body? Well, there's a science behind how cannabis works in the body, and the science is called the human endocannabinoid system. Now, in medical school, pharmacy school, you're a healthcare provider on the line, whatever training you've gone through, many of you were never taught about the human endocannabinoid system. Well, this system is a part of every human being. In fact, every vertebrae has a human or a endocannabinoid system. And this system is made up of receptors that are found throughout our entire body. As you can see in the slide there are receptors found on every cell membrane in our entire body that's looking for cannabis, to lock and send a signal to different areas of the body to maintain homeostasis. And so these receptors are found in the brain, the central nervous system, the periphery, the immune system. It's found in different organs and glands throughout our entire body to put the body again in homeostasis. This system is also made of endogenous cannabinoids. Those are cannabinoids or compounds that our body actually produces. The two endocannabinoids that our bodies produce are anandamide and 2-AG. Now, these two endocannabinoids become deficient, and many times what we call the clinical endocannabinoid deficiency syndrome, we see in many patients who have migraines, who have issues with fibromyalgia, issues with depression and insomnia. In fact, they did a study and they found by doing a spinal tap in patients who have chronic migraines, they found that those patients typically have low levels of anandamide. They also did a study on women who have recurrent miscarriages. They found low levels of anandamide in those patients as well. So these endocannabinoids are really important in keeping the body in homeostasis. And when they're not in good levels within the body, we have conditions like pain, inflammation, insomnia, depression, migraines, a lot of the autoimmune diseases. So it's important that we take in phytocannabinoids. We take in and consume phytocannabinoids like CBD, like cannabidiol, to keep our patients' bodies in balance. So let's look at how that works. Typically when we look at signaling in the body, we always see the presynaptic sending signals to the postsynaptic neuron and then sending that out to different parts of the body. Well, the endocannabinoid system works in a retrograde action, where the postsynaptic area is the receiving neuron sending signals to the presynaptic neuron and then to the body. So what happens, it really looks like a lock and key effect, where you have the receptors in the body and the keys or the cannabinoids like CBD or THC or CBG or CBN, they lock with these receptors in the postsynaptic neuron. They send a signal to the presynaptic neuron into different parts of the body that need to maintain homeostasis. So again, when those keys are deficient or when those endocannabinoids are deficient, we need to take in phytocannabinoids. We need to consume CBD and other products to keep the body in balance. So again, every single organ and gland, all of our major receptors, CB1, which are typically found in the brain and the central nervous system and other organs, CB2 receptors are typically found in the immune system and the periphery, are looking for cannabis products to put the body back in balance. So the science is there. The science was discovered in the early 1990s. The science was discovered because of the scientist Raphael Mechoulam in the 60s discovered THC, and in his discovering of THC, he discovered all of the other cannabinoids that the plant makes. And then he started to discover even more the endogenous cannabinoids like anandamide and 2-AG, which then led him to the receptors and how the endocannabinoid works in our body. So the science is there, the data is there, the research is there, and as physicians, I think that we should, as healthcare providers, we should be open to do our due diligence, to dig deep, to look at the data like Dr. Sanjay Gupta did. So again, this is showing you the receptor activation in the body, sending signals to different areas to get a response. Now, there are some really, really amazing studies that you'll find in the literature. This particular study is looking at cannabinoids in the management of difficult to treat pain. We all see patients in our practice that have difficult to treat pain, be it sciatica or neuropathic pain, neuropathy, a lot of the chronic pain that a lot of the autoimmune conditions lead to. But again, this study is looking at CBD and its use in chronic pain, talking about the receptor sites and looking at how it is very effective in the body. Another study looking at looking at cannabis and cancer. You know, cannabis has anti-cancer effects. It has been studied to reduce the metastasis of cancer cells. Again, a lot of these studies that are very profound studies are out of Spain, out of Israel. Why? Because cannabis, you know, is illegal to do research on. CBD now is legal as of 2018. So you're going to see a lot of studies on CBD. And that's what our patients are looking for. They're looking for CBD products that can be used in conjunction, in addition to the traditional pharmaceutical medication. So again, a lot of the studies are done in different countries. Again, UC San Diego is coming out with studies with CBD as it relates to attention deficit disorder, autism, eating disorders like bulimia and other chronic illnesses as well. This is another case for treating PTSD. This study is looking at medical marijuana. You know, you may have patients that are seeking more information on getting a medical marijuana card. So there's absolutely a lot of data that you can find in the literature. So that's all for me. I'm going to leave you with my email address. There may be studies that you're looking for. I can direct you to where those studies are. I can direct you to where more information is. But ritamd@wakana.com is my email where you can reach me. So I'm going to bring up now and stop sharing my screen. I'm going to bring up Dr. Joy Smith. Dr. Joy Smith is a pharmacist. She is a trained pharmacist and currently one of the lead pharmacists at Stroger Hospital, where I completed my residency. She is an amazing woman. She is a wife, a mom of an amazing little 5-year-old who's brilliant. So brilliant, that little Ayana. And she is also one of my business partners at Wakana, and we will bring up Dr. Joy Smith to the stage. Are you out there?
I am here, Dr. Rita. Thank you so much for that introduction. Let me start my video up here. Got to get all my stuff coordinated now. All right, so as Dr. Rita stated, I am Dr. Joy Smith. I got my doctorate from Florida A&M University, the Florida A&M University, and I've been a licensed pharmacist in Illinois for about 8 years. When I first became a pharmacist, I knew that I wanted to impact change, and I knew that that's what I could do in the healthcare realm, but I also knew that I wanted to get on the other side of healthcare. I wanted to know more about natural methods of healing. I wanted to learn more about how plant-based healing could play a role in the health and wellness of patients that I would interact with. So I became a certified integrative nutrition health coach back in 2016. Then I became a certified aromatherapist because I'm just fascinated with how plant-based oils can have some of the same actions as some of the prescription medications that I deal with on a regular basis. I'm a member of the International Society of Cannabis Pharmacists because, again, plant-based oils, oils that come from plants, components that come from plants that really help people to heal. And I'm a Ruby dispensary owner at Wakana for Life. So all of my skills had an opportunity to be married and bring me to where I am right now. So one of the questions that you all may have as healthcare professionals is, why do people seek CBD? Dr. Rita gave you the top 3 reasons: pain, anxiety, sleep, and depression is also one of those as well. So in a cross-sectional study of cannabidiol users, cannabidiol being for CBD, pain was talked about. Chronic pain is the #1 cause of disability and disease burden globally. Anxiety, there's anxiety disorders are one of the most common mental illnesses affecting 40 million adults in the United States. And it's estimated that 16.2 million adults in the United States have had at least one major depressive episode in a given year. So these statistics are just showing you how these different issues are plaguing our nation as a whole. And even from the Journal of American Medical Association, we're looking at the prevalence of depression symptoms before and during the COVID-19 pandemic. We know that COVID-19 has just ravaged our nation, right? And I think that this one quote is very important. The prevalence of depression symptoms in the US was more than 3-fold higher during COVID-19 compared with before the COVID-19 pandemic. Individuals with lower social resources, lower economic resources, and greater exposures to stressors like job loss, a lot of people are losing their jobs, reported a greater burden of depression symptoms. And if you are like me or Dr. Rita or any of the other healthcare professionals who work in underserved communities, you deal with patients like this on a daily basis. So we're dealing with not only depressive symptoms or anxiety symptoms, we've put a pandemic on top of that and caused a 3-fold higher incidence of this depression. So one of the questions that you may be asking is, are there drug-drug interactions between CBD and prescription medications? We have these natural alternatives to CBD, natural alternatives to prescription medications, whether they be CBD or essential oils, and that pain, anxiety, depression, all these other issues that we're dealing with, there are natural alternatives to address those symptoms, but will there be interactions? So in order for us to get a comprehensive answer to that, I want to dig a little bit into the CYP450 enzymes and how those impact the metabolism of prescription medications and CBD for that matter. So the 6 major CYP450 enzymes are listed here, and they metabolize about 90% of the medications that I see on a daily basis for my patients. They not only play a role in the pharmacokinetics of prescription medications, but they work to metabolize CBD as well. So here you'll see about CBD metabolism, how CBD is a substrate of both 2C19 and 3A4. So when CBD is metabolized by these 2C19 and 3A4, there are a lot of medications that are metabolized by this same pathway. And so there's a potential for CBD to interact with those medications, but if they are spaced 2 to 4 hours apart, then the potential for interaction is very, very low, if at all. So it allows patients to be able to enjoy the benefits of CBD, use it to address any symptoms that their disease states may be causing, but also take their prescription medications. I am not saying that you should ward off all of your prescription medications and never take them and tell your patients to not take their prescription medications. But what I am saying is that as a healthcare professional, as Dr. Rita stated, it's important for us to do our due diligence. It's important for us to know about the natural alternatives to some of the medications that we are prescribing that don't have as many harmful side effects. It's important to be able to suggest alternatives or remedies that don't cause as much harm. Now, I'm a pharmacist saying this. I am not suggesting that there is no place in therapy for prescription medications, but I do know that there is a way to address that symptomatology in a way that won't cause as much harm. So CBD also inhibits 2C9, 2D6, and 3A4. And the reason that that's important is because those are major pathways that a lot of prescription medications that I feel on a daily basis and that the physicians on the line may prescribe, they travel through that pathway to be metabolized. So again, that's why the spacing of the CBD is important. That's why the spacing potentially of essential oils, if that's something that you are recommending in your practice, is important, because once they're spaced out, it is easy to be able to use the benefits of both the holistic and the traditional medication options. So I selected medications that are prevalent in a lot of the people that I service on a daily basis. I work at the county hospital that Dr. Rita stated, now called Stroger Hospital, and we deal with a lot of hyperlipidemia, a lot of outpatient issues, right? Hypertension, heart complications, patients on anticoagulants, asthma, allergy, diabetes, you name it. A lot of over-the-counter medications that a lot of us, even as healthcare professionals, are taking. Yes, they do have the potential to interact with CBD. Yes, they can be inhibited by CBD. But again, if those medications are spaced out, if those medications are spaced out about 2 to 4 hours from the time that they are that the CBD is taken, there is little to no possibility that that CBD interaction will occur. In fact, what I find is that when I'm running drug interaction checks at work, there are a lot more interactions with the current medication profile than there are with the cannabidiol when I introduce that into the drug interaction screen. So that's why it's important. That's why you may see doctors, well, not doctors, that's why you may prescribe for your patients in the morning the blood pressure medication and the cholesterol medications in the evening, not only because they're good to be prescribed at those times based on how they interact in the body, but because they can interact with one another. So I think that it's important to just understand that doing your due diligence, as Dr. Rita stated, making sure that you understand that just because it is a holistic option to healing doesn't mean that it needs to be warded off and not researched. That means that it needs to be researched that much more, because our plant-based options have been around longer than our prescription medications. And that's just a fact. So when we're talking about alternative medicine, you may want to know who's using alternative medicine. And this graph kind of shows some of the treatment trends. So if we're paying attention to the light blue bars at the bottom, from 2014 to 2025, this is how it's being evaluated. And when we talk about botanicals, botanicals are plant-based components that have found medicinal benefit in the research. So as we see, botanicals are increasing in their usage from 2014 all the way here to 2025. That hasn't even gotten here yet. And people are really catching on to the fact that there is benefit to be able to use botanicals, not necessarily in place of, but in addition to, as a complement to some of their traditional medications. And some people find that they can use them instead of, but we are not claiming that you should tell your patients to get off of their medications, nor are we saying for some people that may not be healthcare professionals that you should just completely disregard what your doctor is saying. No. We are saying that botanicals or CBD or essential oils can really impact change in the symptomatology of the things that you're experiencing. So you heard me talk a little bit about essential oils, and then we'll talk about exactly what they are. So they're highly concentrated aromatic extracts that are distilled or expressed from a variety of plant material, including flowers, grasses, leaves, roots. They can be distilled, and the oil that is extracted is what's used for relieving pain, relieving stress, improving mood. And the reason why these essential oils are so great is the science behind these essential oils that has to do with the limbic and olfactory system. So the essential oils, when they're inhaled, they go in through the olfactory system, they interact with molecules in your nasal cavity, in the olfactory bulb, and they go into what's called the limbic system, which is responsible for your emotions, your memory, all of those different types of things. And when they interact, they specifically interact with the hypothalamus and the pituitary gland. And the volatility of these molecules makes it so easy for them to travel through the blood-brain barrier and really impact change in the areas of the body that really need it. So when the aroma passes through the olfactory bulb, it interacts with those sensors in those other areas of the body to impact the emotions, like I said, pain sensors, hormone levels. It can be stimulating. They can be sedative, depending on the essential oils that are used. So this one article from the Asian Pacific Journal of Tropical Biomedicine was really important because it highlights how these essential oils get into the body and really affect change. So once the oils are in the system, they remodulate themselves and they work in a friendly manner at the site of the malfunction or the issue that's plaguing you in your body. And this type of therapy utilizes permutation, combinations, and gets relief from numerous ailments, whether it's depression, headache, insomnia. I won't read all of these because you can see them, but the essential oils are found to be beneficial, which is important, when other aspects of life and diet are given due consideration. You can't expect a holistic option to work when you are eating fried food every day. You can't expect a holistic option to work in your patients when they're not consenting to having a healthy lifestyle. So they may work over time, but they're not going to work as quickly or as efficiently as if those things were put in place. So that's one other thing to recommend to your patients. If you want to go down a more holistic route, make sure that your diet and your lifestyle is supporting that. Okay, so these charts here are really talking about the chemical constituents of essential oils and how those chemical constituents have different effects. So if you're looking at this side, this is the chemical constituent and the effects that it can have on the body. And then you can see some examples of some essential oils that fall into these different categories. So when we're talking about the monoterpenes, the aldehydes, the esters, you're seeing a lot of chemical constituents that can provide great relief in patients. One of the best things about the relief in patients that it provides is that anti-inflammatory relief, can be antiviral, antiseptic, stimulating the immune system. There are so many options and natural holistic options that allow our patients to be relieved of some of their symptoms, not cured, but relieved of some of their symptoms that they may be experiencing in conjunction with whatever disease state that they're experiencing. So there are some essential oil safety considerations that you may want to keep in mind if patients come to you and say, hey, I'd like to use essential oils. Don't apply them to open wounds, especially if you're using them for pain, for instance. Applying to open wounds could cause some irritation. So make sure that that wound is healed. Keep away from the eyes and wash your hands after use, because oil and water don't mix. And what do most people do? Get water, get soap, whatever, and try to cleanse the area. No, you want to apply a carrier oil to make sure that those oils are pulled out of the eye area or the mucous membranes around the eyes. Making sure to patch test a small area or dilute, whether you're using topical CBD products or essential oils, because you don't know how it's going to work on the body or work on the skin area until you've tried it. Reading the warnings, having the patients read the warnings, and making sure that when they're getting essential oils or when they're getting CBD, that they're getting it from a reputable company who has done research, who has tested their products. Of course, if the patients are pregnant, nursing, have serious medical conditions, they'll already be under your care. So you already have the benefit of knowing what it is that they're doing and how their medications are working for them. Just like with CBD, 2 to 4 is what I would actually recommend, space between medications and essential oils, or space between medications and CBD. Because what we know is that plant-based options have some of the same mechanisms and some of the same actions as some of our traditional medications. So if we're adding that on top, we don't want the patients to have to experience unwanted side effects. So more is not better. Sometimes we increase doses of the medications for our patients because we need to address a particular issue. But plant-based botanicals are they're so powerful and they're so potent that you don't have to do that. More is not better. You work up to your sweet spot where you use a small amount to really affect change in what it is that you're looking to do. And if there are some physicians or healthcare professionals on the line that are dealing with cancer patients, for instance, if they can't stand to ingest anything, they can't stand to put anything topically. I'm using cancer patients as an example, but other patients can benefit from this too. Diffusing up to 30 minutes at a time. So if it's in the patient's room, for instance, they're inpatient, diffusing an essential oil, lavender that's calming, peppermint that can really help with that nausea or vomiting that a patient may be experiencing. And then just turn the diffuser off. We don't want to overwhelm those olfactory nerves. We don't want to overwhelm any of our senses, but we want to make sure that our patients are getting the optimal experience when they're dealing with essential oils. So I could go on forever, but I'm not going to do that this evening because I want to make sure that you all have the opportunity to ask questions and that you all can transition over to the 8 p.m. call, where we'll be discussing more information about our products, more information about how these products can be used in your patients. So thank you, Dr. Rita, for this opportunity. I love being on here on Tuesdays with you and our other healthcare professionals. And if you need to reach me, I can put my email in the chat, whether you need any drug interaction information. I'll put my email in the chat. It is your, Y-O-U-R, CBDPharmD@gmail.com. So without further ado, Dr. Rita, I will give it back to you.
Oh, thank you so much, Dr. Joy Smith. That was phenomenal. I want to invite any healthcare professional that's on the line, again, like Dr. Joy Smith said, to our 8 p.m. call, where you can get now more information about specific products that we offer at Wakana and to hear about our opportunity. But we wanted to address the healthcare professionals at 7 o'clock with the science. If you don't have any questions, then we will end here and we will meet you on the 8 o'clock call. The guest, please get the link for the 8 o'clock call from the person that invited you, get that passcode, and we will see you in about 20 minutes.
Good night, everyone.
Thank you so much for joining.
All righty.